It's critically important we raise awareness of sepsis. It is a medical emergency, and if someone is deteriorating with an infection in their home, they need to know where to go for advice so that they know when to go to hospital. My name is Dr. Ron Daniels. I'm an intensive care doctor in the NHS, and I'm also the founder and chief executive of the UK Sepsis Trust. So sepsis is the way the body responds to an infection. So it's always triggered by an infection, and that might be a urinary infection or a chest infection, or even something as simple as a cut or a bite or a sting. But in sepsis, the body's immune system goes into overdrive, and if we don't stop it, that starts to damage our organs. So back in 2005, I was a relatively young consultant in intensive care, and I watched a young man, Jem Abbots, die on my intensive care unit. He was only 37 and he had 2 young children, and I remember as clear as it was yesterday following his wife Karen down the hospital corridor, knowing I was about to say to her that her husband wasn't coming home and she'd have to go home and tell Tom and Emily that Daddy wasn't coming home. And at that point, I just thought, we've got to fix this. Sepsis is just so common. It affects 250,000 people in the UK alone, and worldwide, it accounts for 1 in 5 lives lost. And yet, until recently, very few people have heard of it. It's critically important we raise awareness of sepsis. It is a medical emergency. And if someone is deteriorating with an infection in their home, they need to know where to go for advice so that they know when to go to hospital. And by getting this right, we can save thousands of lives. There are 6 key symptoms to look out for, and they spell the word sepsis. We've got S for slurred speech or confusion, E for extreme pain in the muscles or joints, P for passing no urine in a day, S for severe breathlessness, I for it feels like I'm going to die, and people really do say that. And then the final S for skin that's mottled or discoloured or very pale. Any one of those 6 in the context of infection, it goes straight to A&E. People who've survived sepsis after they leave hospital don't receive any sort of resourced rehabilitation. They don't get followed up in clinic routinely. And many of them struggle. About 40% of people who've had sepsis still have symptoms a year after their illness. So our support nurses help people. They have online support groups, they have face-to-face support groups, and they're there on the end of a phone or at the end of an email to answer questions so that people can understand their recovery, become engaged in their recovery, and become motivated to get better more quickly. So we know that sepsis is the way the body responds to an infection, but just imagine if we had this resource where we could communicate that visually using sort of common household items to really get the message across that this is an infection starting things, but then the body becomes really unwell because the immune system's overreacting. So both of the UK Sepsis Trust and SimplyBetter are organisations who are in the business of communication, and we're both driven to improving outcomes, saving lives even through the use of messaging. I think the 2 organisations coming together is so important because sepsis is a complex condition. The UK Sepsis Trust has been raising awareness of sepsis for many years, but what we now have is opportunity to communicate about sepsis in a really engaging and visual way that people can retain and understand more easily.